I'm Jocelyn Olivier. I'm the director of the Healis Neuro Rehab Center clinic, where we take on clients who have complex problems involving neuromuscular issues and also some neurological issues having to do with stress and trauma, events that have happened to the nervous system that have left a lasting impression on our ability to coordinate and manage to do the tasks that we are challenged to do every day in our lives, like walking and sitting and standing and working. So I want to introduce a tool that we've recommended to clients over the years. We have told them to get 2 tennis balls and put them in a sock and use those 2 tennis balls to re-coordinate the spine and the pelvis and the hips so that the functions of the low back and hips are supported. So this is for any client who has issues that are affecting, that create pain in their lower back and pain in their hips and pain down their legs, but it's also relevant to people who simply have coordination issues, who have discomfort, and it's a good practice for people who have been under a lot of stress or trauma in a recent experience, or even in experiences that happened decades ago, and can be a very useful tool in reprogramming and reformatting the nervous system. So we just say, get yourself 2 balls and put them in a sock. So now we have a product called Tuballz. So Tuballz are washable, durable, are just the right kind of firm, plus indestructible, and they're put inside of a sleeve that is also something that you can is extremely durable, and they can be moved around inside that sleeve so that they are close together when they want to fit on either side of your spine. So this is one of the places that we use them. And then they're farther apart, and you can just pull them apart when you want to use them on your hips on either side of your sacrum. So you can make them closer for where your sacrum is narrow and wider for where your sacrum is broad. So I'm going to just demonstrate for you about what we're trying to do when we do Tuballz, when we use them. What we're trying to do is teach the body what it should be able to do easily in coordination. And the crucial point in your body for the pivot and coordination of your upper to lower half is right here at the diaphragm, where the diaphragm is attached. It's also where your kidneys are located. And so you can take these balls and you can put them at this point in your back, and you can lie down on the floor, and you can use them to simply move your knees from side to side. So when a client comes in and they need an at-home exercise to follow up on the kinds of things that we've been teaching them to do in session, we give them a handout that tells them how to do this. So this is step 1 about where you do it, and in the handout it gives you all the information about why to do it and how to do it and what to think about when you're doing it. And step 2 is they're going to be down here in your hips, and then we're going to be loosening up the hips, and we're going to be doing the same thing. So I wanted to give you a little demonstration here today about a tool that anybody can put together. If you wanted to get hold of the actual handout, the how-to, that's something that we have available here in the clinic and give away freely to our clients. Our step 3 puts those 2 balls right here, right where the junction of the sacrum and the lumbar spine are. And then the movement is different. It's no longer side to side, but it's training the body to do a pelvic tipping back of the spine and a tucking forward, toning the lower abdominal muscles. And so by the time you've done all of those things, you're well on the way to re-coordinating your hips and low back. And it's quite miraculous for getting you out of pain. It's something you can travel with. We have a DVD about this that gives you the how-to for those who need support in learning how to do something like this. And so you can order these by going onto our website and finding our purchase option. They're available for $35 for the instructions plus the indestructible last you a lifetime tool. So I hope to see you here in the clinic, and please remember that if you do have back problems, that the use of a tool can be very handy, but you may need some specific corrections that will help you to benefit from using the tool. You'll need a little education or re-education before that tool becomes perhaps manageable for you. So if you have a pain problem that you would like to have some consultation for, you can always call up our office and ask us for a free half-hour neuromuscular assessment, something we offer to all prospective clients who don't understand what neuromuscular reprogramming can be useful for. So we'd like to have you have abundant opportunity to ask your questions and see whether this modality can be relevant for you. So I hope you'll give us a call and make yourself an appointment. The number is 415-388-9945. We'll see you in the clinic soon.